students, that was fairly recent. That was just around like 1 year or 6 months back. But for second year students and for third year students, that was not so recent. And so we see a progressive decline with the amount of time that has elapsed since the last training session. So that's why we see, or we can assume we see gradual decline. Fourth year students, we see one another boom, and then fifth year students that carries on. So we can, another factor I would like to say comes into play, and that is the exposure to clinical knowledge and the consolidation that brings to a person's theoretical knowledge. Fourth year students and fifth year students progressively scored higher. Now when we divide our questionnaire results based on specific categories of skills that we asked for, we find that while topics such as CPR was scored fairly good by all students, topics such as fractures and the miscellaneous category, they were scored pretty low. So in future, like you can see in the graph, so in any future practices that are incorporated into the curriculum, we would like to see them more appropriately included. Based on those conclusions and discussion, I would recommend that the first year refresher classes should be implemented at more regular intervals, because we see a very clear association between the time lapse since the last training session and how students score. Periodic assessment of first year knowledge and skill is very important, because that way we can be sure that the skills taught to students are not lost to them. Our results are the few limitations, just like any other research. The results only apply to medical students at DMC, they do not apply to students elsewhere in the government or private sector colleges. We only tested individuals' knowledge, we did not test their skills. And then due to excessive workload, there might be some shortage of time and students might not have filled the questionnaire to the exact specifications. Some inaccuracies might have arisen, so that might have an issue. We would like to thank Dr. Nazir Khan. He gave us the opportunity to do this research. Dr. Sina Aziz supported and guided us. Sayyid Al-Nanawi and Mr. Waqas Siddiqui helped us with the data processing. Thank you very much.
Now, I think the whole team on the stage, please. All team members. Now we start a discussion with a brief introduction of the project that Sina Aziz does, the supervisor.
First of all, I would like to congratulate all of you for making this excellent presentation. And I have known this group for quite some time, and the zest which they had for research was quite exceptional, and the way they carried it out was also very good. Overall, it's been a very good project, but there have been certain limitations in this, which you all have very aptly pointed out, that the sample size was not appropriate because we only took a certain scenario. But then, in regards to any research, you have to have preliminary data. So that preliminary data is now available of a predominant medical college of this country. So maybe it can be carried on to other medical colleges. Congratulations.
Thank you, Rasina. Now, students, questions, any comments? Yes.
Assalamualaikum. I am Mohammed Sherlock from Florida. First of all, I would like to appreciate the topic you took because it's very important, and a gap study should be done on this topic because even people have knowledge, but their practices, in their practice, such there's a decline in the first year, right? Secondly, I have a question that when you were doing research about government medical college, why did you specify it to law medical college? Because there are other medical colleges as well, government medical colleges as well, and there are different conditions and training level and exposure to Jinnah Medical College. So why that was not included? Should I repeat the question? I asked you why did you only include Law Medical College and not the other government medical college? Because there are different exposure and there are different exposure in different medical colleges and different training levels in different government medical colleges. So why did you not include all the government medical colleges and just law?
Process of the time period also.
Asya mentioned that the sampling techniques for convenience sampling, and then secondly, the limitations. I specifically said that we had to project this research so they will not be accurately projected to other colleges. So the thing is, our resources are limited, our time is limited, and then we were trying to make the best result.
Okay. Yes. Are there any other question? Yes.
First of all, I would like to commend the group for a very good presentation, and I'd also like to commend the presenters for a very high level of confidence. For a very high level of confidence, and keep it up. I don't do it.
Yes.
Okay, I'll repeat again. I'm Khadija, final year student. I would like to commend the team for a very good presentation. That was very good. And also I would like to commend the presenters. That was excellent. Keep it up.
I think we should continue with the faculty.
Congratulations on the presentation. Very high quality research, I must say. And I'm very much interested in this because I'm the director of this Swiss lab. And I'm sure all of you are attended the first aid still in the first year and the second year. And the questionnaire that you probably posed to the students included those aspects which were not included in the training. So I find my best to include those portions. Thank you very much.
Bismillahirrahmanirrahim. Very good presentation, very good topic. But from your result, I concluded that only knowledge of anything is not enough until and unless you practice it. So your result is showing the result of first year students are passed, proportion of the first year students more as compared to second year, and second year is more as compared to third year. Isn't it? I'm not wrong and right, huh? So, and finally the fourth year final student has less knowledge of this, isn't it? Poor knowledge, huh? Okay. So it means that you need practicing also. Not just giving knowledge is not enough. So I advise Dr. Salim, you may make some arrangement for their practicing it also. Huh? It's a good research.
Okay. Say something? Okay, yes, Lula says it's a nice presentation.
Thank you very much, sir. Very good description, very good topics selected by our supervisor and our education. But few things.